Hello everyone, my name is Chase.
I'm Martin.
I'm Mayank.
We are OTA PTA students from Conestoga College, and we will be repositioning a person in a slouched position into a good seated posture in their wheelchair. Usually you would reposition elderly patients and or generally weak patients that are in this position. In this video I will be a paraplegic patient without the use of my legs and will require the assistance of 2 OTA PTAs to help me with the transfer. The setting that you would usually find this in would be nursing homes, hospital, clinics, and sometimes in-home care. The reason you want to reposition a patient from this position is so that they don't fall out of their wheelchair, so that they have good posture and to help with improved circulation and also to prevent sores and pains on their body. The tools that you might need to help with the patient in this position is a sliding sheet, and that's if, depending what the patient is wearing, you don't want them to have friction or abrasion between their skin and the wheelchair, so you will use the sliding sheet to help prevent that. One of the main things you want to make sure on the wheelchair is that you have the brakes on to help with safety, so that when you're transferring, the wheelchair isn't moving.
So the first thing we want to do is get consent from the patient.
Hi Chase, how are you?
I'm good, thanks. How are you?
I'm also good. I'm Mayank from Conestoga College, OTA PTA student. And I look like that you come out from the wheelchair. It is not good. I think you will be fall down. Do you want to reposition yourself in a wheelchair?
Why do you want to reposition me?
Oh, that's a good question. Oh, in this position, you feel pain in your low back as well as your neck, and might be you develop your pressure sores in your backside. So, in good posture, good position, you will feel better and relax yourself, as well as it is also better for your back. So, do you want to do?
Yes, please.
Okay. So, do you have any questions?
No, I don't think
No
so.
questions. Yes. Shall we proceed?
Yes.
Yeah.
Okay, so the next thing we're going to do is make sure the wheels on the wheelchair are locked.
Right.
And then once it's locked, we're going to move the pegs out of the way. Okay, now next thing, we're going to get Mayank to move the patient's feet so they're in a comfortable position.
Yeah. I'm going to move your feet. Okay. Is it okay for you?
Yes, thank you.
Left leg. Yeah.
Next thing we're going to do is ask the patient to cross his arms and fold his elbows. And Mayank's going to come in and assist the patient in leaning forward.
Please help me to sit forward. Okay. That's good. Very good.
Next, I'm going to come underneath and grab the patient's arms. And Mayank will reach down to grab the patient's legs. And at the count of 3, we're going to slowly move the patient back up to the chair. 1, 2, 3. And now we're going to make sure the patient is fully back in the chair. And yes, he is. If he wasn't, we would do the same thing over again. Now we're going to put the pegs back on so the patient's feet are comfortable. And then we're going to give you a call down. If you need anything, you let us know.
Okay.
So how are you feeling? It is good?
Yes, much more comfortable.
Oh,